The Closers on KFRU and KLIK.
And welcome back for a Thursday afternoon. It's The Closers, and it's time now for our MU Healthcare segment. I'm George Young. Cameron Connor joining from his secure, undisclosed location. It's not under the table this time, too, which is pretty cool. So he's joining us. And also happy to be joined by Dr. Jose Ramirez from MU Health. And welcome in. And as we talked off air, I guess congratulations to you, sir, or Dad. So how does that feel?
Yes, it feels great. Our 9-month-old daughter, Isabella, and she's just amazing. Totally changed my life. It's been great.
So with that, happy to have you alongside. Now, chiropractic care and dry needling are your specialties. And
yes,
let's before we get into some of the health aspects of chiropractic care, dry needling, and we talked to Elizabeth off air. A lot of people think dry needling, acupuncture, similar, what's the big difference? So what is the difference between the two when you hear somebody say dry needling versus acupuncture?
So dry needling, you're strictly trying to affect or trying to improve someone's joint that's swelling or not moving well or a muscle injury, right? Strictly musculoskeletal. You're going to induce healing process. You're going to try to restore range of motion in the joint, reduce swelling. It's a palliative type thing. Acupuncture delves into a lot more, right? So traditional Chinese medicine, you can take care of musculoskeletal issues, but also you're taking care of mental issues, hormonal issues, bad habits, like if you're trying to quit smoking. Things like that, right? And it takes into account the patient's gender, the time of the year, what season it is, the time of the day, in fact, and whether, you have to take their pulse and you read their pulse and you determine that and you analyze what you're feeling and then you look at their tongue. I mean, there's a whole different type of different things that you're going to get into with acupuncture to try to help somebody who's dry needling is straight. Okay, I have a foot that's hurting. And we're going to try to look for tight connective tissue and tight muscles or injured muscles, and we're going to make them feel better by inducing a healing process.
All right, well, that's a perfect transition because for those of us who watched the NBA game last night between the Heat and the Lakers, Goran Dragic goes out. Plantar fasciitis is what the announcers were saying, and that's for folks who have heard it. What exactly is plantar fasciitis, and what are the degrees of the injury?
Good. So you have connective tissue on the bottom of your foot, and the plantar fasciitis means that has been injured to the point where it's swelling in that connective tissue, and it's excruciatingly painful to put any weight on it, let alone go play a basketball game. Right? Anybody who's had it will tell you that.
Okay, But for folks who aren't a professional athlete and they don't have a professional training staff and the doctor's on call and all the rest of that, how do they handle plantar fasciitis? What's the best route to handle something like that?
Okay, so first you want to manage the pain. As a chiropractor, I can't talk to you about taking medications or anything like that by law. So I would suggest using like cryotherapy. You can put your foot on ice, or you can freeze a water bottle and roll your foot over it to lightly massage it with the cold. Will reduce that. You want to stretch to tolerance. You want to stretch your calves. Sometimes you can put on a special sock that'll keep your foot while you're asleep in a dorsiflexed position. It means the foot's all the way up, like before you step on an ant or something, you raise your foot like that, and that prevents it from. That keeps it in your calf and your plantar fascia in a stretched position all night. So when you get up and bear weight on it, it's not as uncomfortable, right? Mm-hmm. If you came into my office with it, then we would look to use different modalities, therapeutic modalities, or even dry needling to loosen up the calf muscles, the posterior, which would be the gastrocnemius muscle, the posterior tibialis muscle, all that affect the tension on that bottom of the foot. And then I would also see, okay, is your ankle moving the right way? A lot of times these things develop if you have a restriction in your ankle and it's not flexing the way it should, things over time get tight and then all of a sudden you flare up, right? And you have those issues. We have a pretty good track record with plantar fasciitis that hasn't been torn yet.
Dr. Jose Ramirez with us here, chiropractic physician over with MU Health. What are some of the things that we can do just on the general to make sure that the back is in good shape and the hips are okay and all that, to keep ourselves in good health?
Well, I always preach stretching, basic yoga movements, and if you're pain-free, right, your back's not hurting you, then go ahead and do movements that induce range of motion, like healthy rotation, healthy flexion, healthy extension, all which can be done in a basic yoga course of half hour. You also want to do hip movements and hip stretches. You want to keep your hips loose. As time goes on and people lose range of motion in their hips, they don't stop picking things off the floor. They don't stop putting their shoes on. So if their hips aren't moving, it all comes from the low back, and that's when things starts going wrong. Things pop, things hurt, right? And of course, your hamstrings have to be loose. It's a good habit. I personally practice it, and my patients that come in, I'm always preaching to them, spend at least 10 minutes, first thing in the day. Find it somehow. Get up earlier, or reduce your time drinking coffee, reading the paper. But spend at least 10 minutes a day stretching those areas: the low back, the hip, the hamstrings, the calves, and it goes a very long way. Stretching your hip flexors or your quads goes a long way to prevent back pain and and if you've had it in the past, it keeps you from having a relapse. Yeah,
well, and one of the ways you can get some of that stuff checked out, Sports Medicine Injury Clinic over at MU Health, Monday through Friday, earlier in the morning from 7 to 8 a.m., but then there's a designated Saturday for middle and high school athletes, Saturday mornings from 9 to 10 a.m., and again, it's a first-come, first-serve. So we tell you, please do not wait until 9:57 to come rolling on in there with an issue that you might have. It's a free clinic, but check it out from 9 to 10 a.m. on Saturday mornings. When you get the athlete that comes in after a football game on a Friday night or a Saturday, and they're complaining about neck pain and maybe because Jen sent me your list, but you can have the headache, you can have the neck pain, a little bit of shoulder stiffness, and as you dive into that, how often is it just it's based on maybe they had that concussion and they weren't aware of it?
You see it. You don't see it a whole lot. Okay. I don't. At least in the college level, high school kids will get a concussion or will get the bell rung. It's the bad ones that you see a lot of neck issues, right? Because of a back concussion is usually when the neck is flexed and it's forcefully rotated, flexed and rotated. It's almost like having a car crash. Car crash, right? It's like having whiplash. So you're going to have a lot of neck issues with the real back concussions. I don't see it very often, at least not around here. And I think probably that's due to the fact that, over the last 10, 15 years, a lot of high schools have improved their strength and conditioning programs. And obviously there's been a great effort within the sport to teach proper technique.
Sports Medicine Injury Clinic, Monday through Friday from 7 to 8 a.m., and then for the high school and middle school athletes on Saturday mornings from 9 to 10 a.m. It's a free clinic. It's a first-come, first-serve, though, so plan it accordingly. Dr. Jose Ramirez, thank you for the time, sir. I appreciate it. Congratulations on becoming a daddy, and you and yours. Please stay safe and healthy.
You do the same. Thanks for having me.
You can join the conversation anytime. Call 442-8255. The Closers on KFRU and KLIK.